Cancer is not just a disease. It is a battle inside the body. Your own cells go out of control. Doctors do not fight your body. They help your body fight back. Today, you will learn how cancer is treated. In a simple way, cancer cells grow very fast, much faster than normal cells. Doctors use medicines to stop fast growth. But some healthy cells also grow fast. Hair grows fast. Blood cells grow fast. This makes treatment difficult. Think of cancer like weeds in a garden. Chemotherapy is like weed killer. It kills fast-growing weeds. But some flowers are also harmed. That is why hair falls out. That is why patients feel weak. The medicine is strong. The fight is strong. Hair cells grow very fast. Chemotherapy attacks fast growth. So hair cells are hit. Hair falls. This is not weakness. This is a sign the medicine is working. Hair can grow back later. Radiotherapy uses powerful rays. The rays damage cancer cells. Doctors focus rays on one area, so only the tumor is targeted. This works well when cancer is in one place. This is called localized treatment. Sometimes cancer forms a lump. Doctors remove the lump by surgery. This works when cancer is localized. If cancer spreads, surgery is harder. Early detection makes surgery easier. Old treatments attack cancer from outside, but cancer learns to hide. Doctors wanted a smarter method. They asked a new question. Can the body fight cancer itself? This changed cancer treatment forever. Your body has an army. This army is your immune system. It fights germs every day. Immunotherapy trains this army, so it can fight cancer cells too. T cells are immune cells. They move inside your blood. They find dangerous cells. They destroy them. But cancer cells can hide, so T cells need help. CAR-T therapy upgrades T cells. Doctors take your own T cells. They change them in a lab. They give them new eyes. These eyes find cancer. Then the cells are returned to your body. The first step is simple. Doctors take blood from the patient. This blood contains immune cells. These include T cells. Nothing artificial is added yet. These are the patient's own cells. The blood goes to a lab. A machine separates the cells. T cells are collected carefully. Other cells are kept aside. Only T cells move forward. This step prepares the treatment. Now the real upgrade begins. Scientists change the T cell's DNA. They add special instructions. These instructions add new receptors. Receptors work like smart sensors. They help T cells see cancer clearly. Normal T cells have weak vision. CAR-T cells get special eyes. These eyes are called receptors. They stick to cancer cells. Now cancer cannot hide easily. The hunter can see the target. One upgraded cell is not enough. Doctors grow millions of CAR-T cells. This is called cloning. It means making copies. More soldiers are prepared. The army is getting ready. Before CAR-T is given, the body is prepared. Doctors reduce cancer cells first. This gives CAR-T space to work. The battlefield is cleaned. The new army can enter safely. Now CAR-T cells return to the body. They enter through the blood. This is given only once. No daily injections. No repeated doses. One strong mission begins. CAR-T cells move through blood. They search for cancer cells. When they find one, they attach tightly. They block its food. The cancer cell weakens. CAR-T is very powerful, but it is very expensive. It needs advanced labs. It needs trained doctors. In India, it costs less than abroad, but it is still costly for many. CAR-T gives new hope, but it is not magic. It does not work for all cancers. Research is still growing. Every year, treatment improves. Hope is becoming stronger. CAR-T is given only once. Not daily. Not weekly. This is different from chemotherapy. One strong dose can work for years. This reduces repeated hospital visits. CAR-T is not for everyone. It is mainly used for blood cancers. Doctors decide who can receive it. Tests are done before treatment. Safety comes first. Right patient, right therapy. CAR-T is powerful, so side effects can happen. Fever may come. Weakness may come. Doctors monitor patients closely. Support care controls these effects. CAR-T needs advanced labs. It needs trained teams. It needs strict safety rules. Not every hospital has this setup. This is why CAR-T is still rare, but access is slowly growing. Cancer treatment is changing. Medicine is becoming smarter. Immunity is becoming stronger. New therapies are coming. The future looks more hopeful. Science is moving fast. This video is for education. It is not medical advice. Always consult a doctor. Every patient is different. Treatment must be personalized. Understanding cancer saves lives. Share this knowledge. Help your family learn. Early action gives more hope. Knowledge is power.